We're done. I'll tell you, my girlfriend that had a full body lift and I was taking care of her and she wouldn't stop crying and I kept trying to call the office there. They were so harried. And the amount of money that she paid, it was like $100,000 or something crazy, right?
They left me for, I don't know how many hours, but I was on the operating table left, like they went on lunch. She left me on the table because there's no, my surgery was not supposed to be that long. And not long, like hours.
Hey everybody, I'm back. I'm here with my friend Amber from Facial Lounge. Thanks for coming, Amber.
For having me.
Anyway, I wanted to talk about this poor lady that is a housewife that thinks that she has some sort of parasite in her face.
I've heard about this.
It's like, she's so beautiful and like, what happened to her? So let's check this out, okay, guys, and see what you think.
What happened to her face? Real Housewives of Beverly Hills star Brandi Glanville is sharing this photo of her disfigured face. She captioned the image, "Sick of it. Look at the puffiness and craters."
I have a parasite that jumps around my face. It lives in the skin in my face. It'll go and jump around to different places and just get lumpy in all the different places.
I've been in and out of the hospital this past year and a half, spent almost every dollar I have trying to figure it out, she writes. She also says it might be stress-induced edema. We showed the photo to dermatologist Dr. Michelle Henry. Could it be a parasite?
It could be a parasite. We know about things like scabies. Fleas could even do this.
The former model has been cast in and out of the popular Housewives franchise since 2011. She's notorious for causing lots of drama.
I will kill you.
You do not want to talk to me like that.
Now this.
Girl. Well, okay, so I used to just do general derm. I do a little bit, I guess, still. For a parasite to cause that much damage, it's like it has to be flesh-eating, right? Because she had such beautiful, like, skin, and now it's, like, got craters and lumps and bumps. I almost wonder, did she try to take out all of her filler to, like, an extreme? A couple of things, I think. Is she on Ozempic? I hate to say that, is she? I don't know, because it makes your skin do some funky things. I have a lot of people coming in going, oh my God, look at my face. And I'm like, well, that's what happens when you lose weight too fast. Like, what? All of a sudden you got like hanging structures.
Yeah.
Right? It's like, well, now you got some hanging structures and we got to re-tackle up there. So I don't know. I feel like that could be it. A parasite. So scabies kind of like look like a raised little, I don't know. Have you ever seen anything like it?
You know, interesting enough, when I heard this story, I recently, and this is very, very rare, I see a million faces, do know someone, and
that they had a parasite in their face?
I don't know what it is. I that's what I thought, but I remember talking to her and seeing like this red thing kind of move, and I thought it was weird, and then it was in the skin. In the skin. It was like,
how did it get from here to here?
It moved around. I was like, okay, wait, am I going crazy? Because I just thought it was on that side. But literally, I could see like this red inflammation in her skin, and she had really bad, like, dry skin. I mean, her skin was so messed up. So she drinks a lot, and I just found it fascinating. That
was it welts?
It looked welty. It did. It looked like a welt, like you scratched her face, but that would go away, and then another one would appear, and it was all along through here, like all this, and she was telling me I was going to have her come in for something else. And when I was looking at her face, I was like, it's so much more than what I'm even capable of. Because I just
get help.
She did. And so I said, I want you to go get your gut checked out and all the things. So I never found out what it was, but I'm like, I really wanted her to go get tested for parasites or I mentioned it. I mean, I made it in a
But if you have parasites in your gut, they're not going to be oozing around your face, right? It's not the same thing. Like, but I'm hoping she just live right here either. Like I look at her neck and her.
Well, that's what I was going to say. They'd have to move around. They can't just live in your cheeks. But it was a very weird, similar situation like this.
I mean, I'm not quite back to normal yet. I mean, people keep on asking me if I've lost weight, and I haven't. I've actually gained weight, but I've lost teeth. So I lost 5 teeth out of my head. So my face has been looking really thin. And outside of the gymnastics that we both know it has been doing, my girlfriend Phaedra was at the dentist and she was just telling my story to her friend, the dentist, Dr. Ange. And then Dr. Ange just wanted to help. I mean, it's the holidays. She's giving me the gift of smiling again. And we're in the process, so I have one new tooth in the back, which I'm so excited about. I can eat again. I'm not like chewing on the front of my teeth, and I can smile again.
Let herself get to this point, though.
You know,
I don't get
it's
it.
a work in progress, and I'm actually happy for the first time in about 2 years. If you can't smile, you don't. When you feel like you don't feel good if you can't smile. And I was joking with my son yesterday because about the Housewives. I'm like, I'm toothless, not homeless, because I mean that's the case. I'm not the other way around, but I could be homeless very soon if I don't get a job. If you can smile and you can eat and you're not hiding your teeth, or like I did not want to eat in front of people because I was like chewing on the front of my teeth, and it's just not, you don't enjoy food as much, but I still got it down. But now I can like go to brunch or go to breakfast or go to lunch and not feel self-conscious. Okay, I know that we talked a long time ago about this stress-induced angioedema. Well, when your face swells up and goes down and swells up and goes down, your teeth move. And I had a bridge that was very, very old. And unbeknownst to me, there was, an infected tooth underneath that. I'm honestly not saying.
Okay, so that's what it is she's getting these weird flares of swelling is basically what that means. And
that's just health. I mean, also losing teeth means you're unhealthy.
Totally.
So there's something
losing your teeth.
Yeah, there's something going on. Like she's deficient.
That's what I tell my kids all the time. Like, you want to have your teeth for life. Start taking care of them now. Like, I don't want to lose my teeth, right? Like, that's a big deal.
It's a really big deal. I have been years here because I played Marco Polo at the pool and I didn't cheat and I had my eyes closed. And there's a polo, and I went, and I knocked out. So these are actually veneers. Thank you, Dr. Spath. But not to cheat. But I wouldn't have got them because I did buy the rest of my teeth are mine. But knowing if you lose your teeth, that's really a lot. There's a documentary called Root Cause.
Oh yeah,
oh my gosh, have you seen it?
No, I'm about it. The teeth all the time. Telling people
it's a
teeth.
So if you're losing teeth, that is definitely like gut related too.
All right, let's see what is this one?
When I look in the mirror, I don't even recognize myself.
Crystal Touch no longer sees herself the same way. From her left eye,
I could actually feel it dying.
She no longer sees.
I have no feeling of it blinking. My perception is different. I see nothing at all. Nothing. It's just dark.
On December 2nd, 2021, Crystal went to VIP plastic surgery on Sunridge Heights Parkway in Henderson.
What I was trying to get done was a non-surgical rhinoplasty, which is getting injected in my nose.
An injection of hyaluronic acid under the brand name Restylane. The goal, to improve the aesthetic contour of her nose.
My bridge will be built up, my tip will be lifted. Nothing was explained to me that the side effects of going blind.
Medical expert Dr. Philip Robb says fillers like Restylane, especially when performed in the nasal area, present serious risks that are not generally known by patients. Veins running through the nose supply blood and oxygen to the eyes.
If you occlude it, which is what a filler can do, it's like a stroke. You're having a stroke to the eye.
Attorney Dan Carvalho is representing Crystal in her lawsuit against VIP Plastic Surgery, which is owned and operated by Dr. Christopher Corsandi. Crystal is suing Corsandi and registered nurse Diane Hamu, who, according to the lawsuit, performed the procedure on her own. On her Instagram page, Hamu advertises herself as a master aesthetic injector.
When she injected the tip of my nose, I felt it shoot straight up to my left eye. And she seen that something was wrong because I started tearing up and I started squinting. And I told her I couldn't see. And I felt a little pain. But as she kept injecting, she's like, oh, that's fine. And then as she kept injecting, the pain kept progressing. And then that's when I started crying. And I was like, I can't do it no more. It's hurting. And then she left me.
The lawsuit says Nurse Hamu left to get Dr. Khorsandi, who should have been involved all along.
What happened here is there was a nurse masquerading as a licensed practitioner, and Dr. Khorsandi has delegated all of his obligations and responsibilities to the patient to a non-practitioner.
In his declaration to the court for Crystal's case, Dr. Robb quotes this publication from the Nevada State Board of Nursing. He explains that under Nevada law, a nurse such as Diane Hamu cannot prescribe, self-furnish, and thereafter self-administer Restylane injection to a patient as she did here. The licensed MD must actually examine the patient, write the prescription, maintain control of the cosmetic medications, and monitor access by the nurse.
Not only did this patient not get the physician consult that was required prior to the procedure, she didn't get the immediate physician intervention that's necessary after the complication arises.
What was your interaction with Dr. Khorsandi?
None. It was only after the fact that I went blind.
According to the complaint, Crystal's medical records show she had a 10 a.m. appointment. Khorsandi's notes in the record say Nurse Hamu came into my office around or between 11 and 11:30 and went into my medicine refrigerator while I was in a meeting. He says nearly half an hour later, his medical assistant told him there was a medical emergency with a patient being injected by Diane and now could not see out of one eye.
He came in agitated. He came in. I felt like I was treated like an animal, like he was yelling at me. He was trying to fix whatever Diane did. Because I waited a long time and I begged him to take me to the ER for a long time. And when he came, he kept yelling at me, screaming at me, "Open your eyes."
This photo, taken later that day, shows an incision on the bridge of Crystal's nose. Carvalho explains the scar is from Dr. Khorsandi using a scalpel to open and inject medicine in an attempt to treat the problem.
All I wanted was his help because he was a doctor. But instead, he treated me like I was a burden.
Khorsandi declined an on-camera interview. His office sent a statement saying Dr. Khorsandi was not the practitioner who performed the treatment. He looks forward to defending this lawsuit
in a court of law. This is the worst possible scenario of sad. There's so many things that could have been avoided here that's so sad. Just like hurts my heart to watch, right? Like, okay, first of all, that's an untrained nurse to not know that you would stop immediately, right? Anybody, it's not normal to feel like that kind of pain where you're crying. Like, it's kind of achy pain, like, you know.
And down to her thigh.
And blurred vision, girl, I would water eyes, screaming bloody murder. But I don't know why he scalpeled her, because now what you got to do is you got to try to open up that blood vessel so you'd be shooting where she shot, you know, where the nerve got crushed.
She probably didn't explain that it was a tip. He probably thought it was here and not here.
Well, it's connected, so maybe I don't know what he's thinking, but usually you try to do this retro bulbar where you literally try to go up under the eye, but you need a really skilled ophthalmologist to do it. So it sounds like he didn't even know what to do. But I mean, and some people don't even have the medication, but that poor girl, it was just turned into like it being her fault. Like, how is that her fault? That poor patient. I feel really bad for her.
This is common in plastic surgery, really common in plastic surgery. I hear a lot of crazy stories that they're great until the aftercare. The aftercare, they just, once they get the money and they're done with the surgery.
Wow.
And facelifts and tummy tucks and breast lifts, they're gnarly.
They're gnarly,
and
yeah.
people don't realize you need someone to hold your hand. And when they're done, they are done.
They're done. Oh, I'll tell you, my girlfriend that had a full body lift and I was taking care of her and she wouldn't stop crying and I kept trying to call the office there. They were so sharing. And the amount of money that she paid, it was like $100,000 or something crazy, right? And I was just like, wait. I mean, they kept like treating me like a total jerk too, where I was like, hello, I don't do this. I don't know what's wrong. I was like, did I medicate her too much? Not enough? Like, anyway, she just wouldn't stop crying. I was losing my mind. And so yeah, the same kind of feeling as this poor girl had. I definitely.
It's almost like they get annoyed and angry.
Yeah.
I had 2 breast lifts, and the second one, I went to Hoag because I have the gene, so they went and did a bunch of little markers, and to send to pathology. I never talked about this, by the way. And not only nothing was sent to pathology, but I was under.
They took it out and forgot to send it.
Mm-hmm. It was the most horrific story. I asked for my notes later because I didn't do anything about this.
Oh, girl, I could go on and on about Hogan. My whole deal.
They left me for, I don't know how many hours, but I was on the operating table left. Like they went on lunch and left me on the table because my surgery was not supposed to be that long. And not long, like hours. And longer than it was supposed to. It was the weirdest thing. I think I was under for 9 hours and it was supposed to be like 4.
What?
And then nothing got set, but I got a really bad infection, and I knew so they go, no, it's fine, just put saline on it, and I just knew, and I drove myself to Hoag, and the second they saw it, I mean, you could stick your finger in it.
Oh,
so scary. And I never talk about this, but I learned so much about wound care. Dr. Bain, who's at Hoag, was awesome.
Oh, who helped you? So, jacked me up.
Well, so this is a...
Well, I guess it's just like anything. It's a huge hospital. Who knows what we're going to be good.
The wound guy was good. I feel like the wound people are a little different than the plastic surgeons. Actually, Dr. Bain is a plastic surgeon, but he's also the wound guy. He's the one but he called the doctor from the hallway. And he's like, if I see one more of your patients... So I'm like, this happens all the time. They don't care. Once they get the money, they don't give a shit.
Yeah, they don't. It's super sad. This one obviously he was angry. And I mean, I don't know why you'd be acting that out.
Well, that's what I was going to say. Right. I was in trouble. When I showed up, they yelled at me like, what did you do? And I'm like,
me too.
Followed every protocol.
Yeah, I do.
I'm a perfect student.
Yeah.
So I was getting in trouble because they don't want to be alive.
Yeah, I know. I had an infectious disease doctor screaming at me saying that,
Oh, at Hoag? Girl or guy?
A guy. He no longer works there, though. I think he's been arrested since.
Really?
Yeah.
Because he was just horrible.
I don't know if I don't know. Can I say what he was arrested for doing some shenanigans with his patients, I guess.
Oh, wow. Well,
and
that's interesting.
Yeah. It's a big old paper. It was in the newspaper. I was like, oh, my God. That's
the asshole.
Yeah. He was something else, let me tell you. But... yeah. So, yeah, you guys, that's what you need to ask people. Like, what are you going to take care of me? That's the biggest thing. You know what I would tell you? Even if you're going to have plastic surgery, let me tell you guys this with whatever. You don't want to ask to see their best pictures. Maybe ask to see their worst pictures and ask how they took care of them. That's what you really want to know, because we've all had mistakes. I've definitely had things that I've been like, oof, that didn't work out that great. I didn't do a great job on that. I'll give myself a D on that.
Yeah.
I want to redo it. That's my heart. Like, I would never be like, you signed a consent, get out. I mean,
yeah,
the money will come back around. It's not about that. Like, it's a human being. And actually, that's our biggest thing, like this year too, with the girls. Like, our whole mantra is, when customer service happens, it's like, I want to teach you guys customer service in one sentence. Treat somebody how you'd like to be treated. That's it. So just ask yourself that in that situation. Yes, we do have some that are crazy and out there, right? Just you're too far out. You want everything. You're nuts. You want to look like a Barbie doll, or you have these weird ideas. And that's usually the people that have to go to some weird extent of getting an attorney or bad Yelp reviews. It's because they're nuts. I mean, those are the ones that just, they're out there.
It's funny because I wanted to bad Yelp, especially a couple, and I share people. And people are scared of them. These kind of bully doctors.
Oh, they're scared.
I am. I never yelped. I never talked about it. I was scared.
Yeah.
I know people who also saw the same plastic surgeon were scared. Like, he was just a bully, and he was real nice in the beginning and kind of a bully. And it's a bizarre thing. That's why I was like, when she said that, I'm like, I know what that energy feels like when they make you feel like you did something wrong, and you don't know what to do, and you're in pain and you're hurt and you're so vulnerable.
Yeah.
That's when they need to.
Imagine going blind and having him scream at you. Like, are you kidding me? I would be hysterical hugging her going,
look, you're going to be okay. We got this. Get her to the hospital.
Yeah. Like, she needed an ophthalmologist is what she needed.
Yeah.
Somebody to open that artery back up. That just goes to show you those do-it-yourself stuff, you guys. Are you kidding?
Around the eyes?
Just anywhere. It's all connected. It's a web. Don't do it. Do not do-it-yourself shit, and don't go to shady places, and find somebody that will take care of you if it goes wrong. Because that's what happens to us is we get people, or some places don't even have the medication to reverse fillers. That's the thing. You can reverse them. But you have to be skilled and know what you're talking about and know what you're seeing.
Yeah.
It's not just like
be the 3 questions. If someone were to call, they're in the middle of nowhere, they want to call a place, they can't get DermFx, what would be the 3 things that you would that they should ask when they call for filler?
I would want to know just how many have they done. That's one thing. Like, since different degrees can do this, like I've been doing it for 25 years. I feel like you're going to be safer with me than, let's say, an MD, PhD with no experience, right? So it just depends on like how many they've done. I don't care what their actual degree is, but how many have they done? Like, and yes, I've seen every type of bad situation and been in every type of bad situation. And it's time is of the essence, man. So you better be someplace where they know that and do a lot of fillers. If this is somebody doing it on the side or doing it at their house, or I don't know, buyer beware, because things like that can happen. And then they show up to us. If I'm not there, I know my nurses won't usually even take them because they're afraid.
No,
but then
they have to be cautious.
Oh my God, but the person could go blind or have necrosis of your face where it
and then you guys get liable if it's someone that didn't do it. So what would number 2? So you ask, how long have they, or how many procedures have they done? What would number 2 be?
I would ask the volume of patients that they just see, period. Like, I would want it to be like a place that's doing it all the time, not like a place that does it on Tuesdays and Thursdays, or not a place that like has somebody come in on a Wednesday. Like, no, that's not a place that you're going to have that boom, boom.
Wow, yeah. And number 3
would be, do you have medications to reverse if it goes wrong? I mean, do you have that medication? Because the medication's also expensive, so you'd be shocked how people are cheap. We have people calling us on the phone and saying like, oh, we have an occlusion. Can we buy it from you right now? I'm like, are you kidding? Get out of here. Why? We have like bottles and bottles of that stuff sitting around.
That's crazy.
People are weird about what they're cheap about, right? Cheap. And then it's somebody's livelihood, though. So I hope people save money on your clothes. Target's got super cute stuff, I think. I mean, you can save money on so many things, but like not that.
Not that. So
not that. Don't also situation
with plastic surgeons, like Oprah did something years and years ago, but it was interesting. It was like, they get asked them what their like life is like. She's like, doctors who are going through divorces.
They're humans.
Yeah, when they're going through divorces or they have a newborn baby and they're not sleeping, they actually mess up more. And there's real doctors. This is from a long time ago, but now we really know that. And I've been out with doctors who are partying, who are drinking.
Oh, me too.
Plastic surgery the next day, and you're like, no, go to bed. Or I've been with people. I actually think I saved a girl's life. I was with her. She's like, I'm getting a lift in a couple days. I'm so excited. And she's like, we're in Laguna. And she's drinking. I go, you can have alcohol. She's like, I know. I'm like, no. Like, literally, you might need to postpone this. Your blood's going to thin. You could, like, no alcohol, no cigarettes. Like, no. Like, this is crazy.
You only have one body, folks.
Oh, my God. And they think that money can't buy it. When you're under that knife and you're bleeding out, money can't buy that. You have to take this stuff serious.
You do.
The before and after is gnarly. And I get calls. If I didn't do this, I would do wound care. Like, I secretly like wound care, which is like pretty gnarly shit. I don't know why or what, but it's like,
oof,
it's so weird. It called me. I don't know why. I'm like obsessed with closing it up and healing it. But
I like to close it. I like to watch it. I don't like to be in charge of all that.
It's hard, but people don't realize. So it's like, if you're getting plastic surgery, please take the time to just like to eat the cleanness. It's not a quick fix.
No,
it is like, and you have to be your best version, the healthiest version. Eat so much healthy food. There is no alcohol. There is no partying. There is nothing.
None at all. Like,
and it's not a cheat code. It's serious.
Super serious. Okay. Well, thank you guys for visiting us again. And if you need any more tips or tricks, you have questions, let us know. You can always ask Amber from Facial Lounge, and I'm Erin from DermFx. All right. Thank you guys. Stay safe.